Hey guys, so today's lecture is a mix of information that you can get from your textbook, from the chapter that you're supposed to read about government influence and public health, chapter 12, as well as some of the information from the Centers for Disease Control and Prevention. And yes, I am very excited about that eagle that just flew across your screen. All right, so what exactly is the government's role in public health? What are their major jobs? Well, first, they're here to help prevent epidemics and the spread of disease. The U.S. public health infrastructure, public healthcare infrastructure, needs to be able to map and understand how diseases are progressing across the country. So part of that is taking health data and health communication and communicating that in a very strategic way to say, we understand that there's some kind of outbreak in this community or in this state, and we're going to help map it using our epidemiological tools so that we can have a better understanding of what's going on in the country. And then if we can understand what's causing this health problem, if you remember going through the Perrier process of defining the problem, understanding the symptoms, understanding what's the etiology or the cause of the problem, making recommendations to stop the problem, implementing those new interventions, then evaluating. That's really what the government's doing at a larger level. So when there's some type of public health outbreak or some type of issue, data is gathered from the local, from local entities, local government, communicated to the state. The state then communicates that to the CDC, Centers for Disease Control and Prevention, and the CDC actually also communicates that to larger entities such as like the UN, so that we can get information in a timely manner on global health as well as international health or national health, and then also with an understanding of what's local health issue. They're here to help us protect against environmental hazards. I'm sure you guys can think of some examples, whether it's radiation or whether it is the Flint, Michigan water crisis. Part of the government's job and part of the EPA's job is to monitor if there's any type of exposure to hazardous chemicals, if there's any type of contamination, understand what's going on and conduct an evaluation of where that environmental hazard is taking place, map it out, and understand how best to respond to that in a timely fashion. Next, they're here to help prevent injuries, right? Whether it be in your car, in your home, in your workplace, in hospitals, right? There are all different forms of ways that buildings can get certifications, that there are different building standards so that the buildings we're living in are up to par, that roadways are safe, that our bridges are basically our transportation infrastructure are safe for people to prevent injuries. They're here to also help promote and encourage healthy behaviors. I don't know how many of you guys remember Michelle Obama when she was doing the Move More, Eat Right campaigns. And you saw her maybe with different celebrities that were pairing up and talking about the importance of getting enough physical activity and exercise and the importance of eating healthfully, right? They're also here to help with other health topics, right? Such as like anti-smoking. How can we get people to help prevent some of the most preventable diseases? What are other ways that we can encourage people to be empowered to enact healthy behaviors that'll help prevent and control disease? Responding to disasters and assisting communities in recovery. If any of you guys remember Superstorm Sandy or Hurricane Katrina or the storm that, Hurricane Maria that affected Puerto Rico last year, part of the government's job, as well as the branch that's in charge of emergency management and response, FEMA, are all part of a system that first is meant to respond at a local level or like a community or county level. And if the community or county if they do not have the resources to respond appropriately, then the neighboring states of wherever or territories of wherever that natural disaster occurred jump in and help, followed by other resources are being pulled to be able to most effectively respond to an emergency. And then they're also in charge of assuring the quality and accessibility of health services. So making sure our healthcare providers have done the necessary testing and gotten the necessary hands-on clinical practice, right? That's why before nurses and PAs and physicians are actually allowed to work on patient populations, they go through rigorous training. They make sure that our healthcare facilities, such as our hospitals and clinics, meet a certain standard to provide high quality care. And just trying to make sure that these services are also accessible, whether it's financially, ensuring that we've got health insurance programs in place to extend access to care, as well as open to populations to be able to receive them at a time that's timely care and also offering high quality care. So I have this picture on here just to show some recent examples of topics that the government has, in which they've gotten involved to help protect public health, to help prevent and control disease. At this picture with the baby, I'm sure you guys can remember the Zika outbreak. And so how can we really encourage mothers and expecting families to use mosquito repellent with DEET, to cover their arms, to stay out of areas that in which might increase their risk of becoming infected with Zika, that would in turn impact the health of their babies, right? There's also, again, the example of Flint, Michigan. How do we ensure that people have access to healthy water supplies, right? This example with the pills is how to respond to an opioid epidemic. It's not getting any better. What can we do to help people not become addicted to pain medications in the first place or opioids in the first place? What are some other pain management techniques? How can we better monitor these medications, and how can we help people who are currently addicted to remove that addiction and to seek treatment, healthy treatment, so that they don't go through terrible withdrawals? Or how do we help them so even if they go through withdrawals, that during a time of stress, during a time of angst, they don't go back to this thing they used to seek comfort in, right? That very addictive substance that they found refuge in. They found a quiet, a calm, right? That's often what happens with addictions, is that people self-medicate by, self-medicate anxiety or fear or depression or just numb out using certain substances. And so how do we work with people to make the necessary physical, spiritual, mental health changes they need in order to stay clean? Again, here's an example of being physically active, a physical health report card. So that's just health promotion. This, I don't know if many of you if you remember 9/11, but the attack on the World Trade buildings, the Twin Towers, I'm sorry, that's what I meant, sorry, the Twin Towers, during September 11th in 2001. And so that's actually kind of what jump-started the creation of emergency preparedness and response within the CDC. Interestingly enough, right? That was the first time that the Centers for Disease Control and Prevention said, maybe we need to also cover both man-made and natural disasters and have a branch of our public health entity that focuses on responding, preparing for and responding to disasters. And then last but not least, I have the Affordable Care Act. We all know that is this huge law that was aimed at trying to make healthcare more affordable, to reduce the gaps in the have and the have-nots. We'll talk about that in a lot more detail when it comes to the discussion of health insurance, and also kind of talk about the pros and cons to the Affordable Care Act, where it went well, where it could be improved, etc. All right. So next up, we'll talk about some of the different essential public health services. So some of the core functions. Sorry about that. I didn't mean to grab my nose in front of you in class. It's not very well mannered of me. Sorry about that. So the core functions of public health, there are three major core functions, which include assessment, policy development, and assurance. And there are different tasks that fall under each of these different core functions. For your first exam, you're going to need to be able to differentiate between what does assessment mean? What does policy development mean? What does assurance mean? Think of it this way. First of all, with assessment, you need to assess what's going on. You need to know what's happening. How do we understand the state of affairs of public health? How do we assess what's going on? How do we take information and make sense of it so we understand what's the pulse, what's going on in public health, right? And so there are a couple ways to do that, and we'll go through that. Next, we want to create policies and interventions that say, we know what's going on. Now we want to prevent and control disease that's linked back to whatever was that health problem. Last but not least, there's assurance. You guys might hear my mom and dad's dog. That's delightful. I get distracted too. It happens. Sorry, guys. Last but not least, there's assurance. We want to assure high quality access to care for populations. So let's talk about what goes into each of these, right? So again, remember that there's assessment. You want to figure out what's going on, right? Step one, what's going on? What do we need to address? What's going to be our priority? Once we know that, and once we know the etiology, remember that word, that means the cause. Once we know the cause of what's going on, what do we think will help stop there being further damage? And what can help prevent and control disease? And that's part of policy development, is creating laws and interventions and putting things into place to reduce negative health outcomes. And last but not least, there's assurance, saying how can we assure a healthy workforce who can carry out high quality care. So first things first, monitoring health. We want to take health information. We want to take vital statistics. What's causing people to get sick? What's causing mortality, right? Death, right? What are the new incidents of disease, right? Incidents being that new number of diseases, if you remember that from Perrier. What's the prevalence of a disease? How much was already existing prior to announcing the new cases, right? The total number of that disease, and then the incidence really being the new number of diseases. How do people perceive their health? What kind of health surveys can collect that information so we can get a good picture of what are those symptoms and what's going on. Next, we want to diagnose and investigate. So we've got the symptoms. Now we want to see what is the etiology, what is the cause, what is going on in this situation. So taking that health information, making sense of it from a medical standpoint, from a public health standpoint. Let's get a diagnosis. Let's fully investigate what's going on. So let's say now we know what the etiology is. We want to inform people and educate them and empower them to help prevent and control any negative kind of health outcome coming from whatever's causing the problem. Okay, if you're not getting enough physical activity and that's leading to obesity-related chronic diseases, we really want to be able to give people the information they need. This is how much you need to exercise, how often you need to exercise. This is what you need to take into consideration in terms of your diet. You need to cut out the trans fats. You need to reduce the amount of sugar in your diet. What is the information that people can take and digest and use to improve their health? We also want to mobilize community partnerships. We don't live in isolation. You've probably heard that saying, no man or woman, no woman, no man is an island, right? We're all parts of communities, whether it's our school organization, our family unit, our neighborhoods, our places of faith, if we practice a faith, our online communities, right? We're nested into different types of communities. So how do we mobilize communities? How do we give them information and give them resources so that they can respond to some type of negative or even positive stimuli, right? How do we, let's take for instance, I'll give you the example of Hurricane Katrina. My parents live in Mississippi. This is something that was very real that affected all of where my family's from. So you got this hurricane tumbling towards you, winds of over 100 miles per hour for hours coming towards your state, right? And just going down this hurricane alley, just pummeling towards your hometown. And you got to get people the information they need to get out and to respond. You need to know where to go for shelter. You need to know what kind of emergency preparedness tools and information do people need. You need to give them, where can you go for a shelter? You need, again, just to be able to work with the media and work with communities to say, this is how you should respond to have the best health outcomes. Next up, you want to develop policies. What overarching rules can we create that'll help mitigate or even prevent disease, right? Giving the example of again, obesity. How can we make sure that people know the caloric intake or the nutritional value of the foods they're eating? Well, maybe you make it a law or mandate to post nutritional information on the outside of food packages. When you're going to a fast food restaurant where people generally tend to underestimate the amount of calories and amount of sugar and fats and salts they're eating, maybe you should make it mandatory for fast food restaurants to post the nutritional values of the food. Little did you know that mochaccino you're drinking from Starbucks actually had 60 grams of carbs and, multiple calories that you didn't really foresee consuming, right? Because we tend to underestimate how much we consume and overestimate often the health benefits of certain activities, right? So you start developing different policies that create those rules to make it easier, to make that environment around people easier to live healthier lives and to live empowered lives with information and resources. So again, that's all part of policy development. What are some of the answers? What are some of the interventions that we could put into place to increase the likelihood that people can live healthier lives? And last but not least, we want to assure that we have a healthy workforce and that we have high quality healthcare facilities. How do we enforce those laws or policies that we've created? How do we make sure that people have access to care and that they've got high quality care? And how do we make sure that these healthcare providers are actually really good healthcare providers? I'm going to give you guys so many examples of, of living in Miami, because again, that was the last place I lived prior to moving to Arizona. So when I lived in Miami, I worked with HIV positive populations. And there were, and largely, I built community advisory boards for lesbian, gay, bisexual, transgender populations to say, how can we make sure we provide equitable, competent care, especially for our LGBT communities, right? And when I started talking to some of the people, some of the folks that were in my research project, they were telling me about how some of their friends were transitioning, that they were getting beautification enhancements to kind of pass, to have the outer appearance of how they felt inside. So to have breast augmentations, to have different surgeries that made them look a certain way. And one thing that they found in like the early mid 2000s were that, especially if you had low income, if you were low income, you didn't have health insurance, and these are optional surgeries or optional treatments, that people were going to basically quacks, right? Like people that didn't have an MD, an MP, an RN, the medical degree and the training to do the types of surgeries and procedures they wanted to do. So people were actually injecting other people with Fix-A-Flat. So people were showing up sick and poisoned in the emergency room, and people couldn't understand, like, what is going on? Why are these people being injected? And later they came to find out that these people, that the folks that were going for these beautification treatments were going to these people who were offering lower cost care. These people had no training. And again, they were taking something that's used to fix tires, injecting it directly into people, and calling it a day. And often that led to death, morbidity, and emergency treatments to try to remove this poison from your body. So again, it's not enough just to have access to healthcare. You want, first of all, credentialed healthcare. You want high quality. You want to make sure that your hospitals and your healthcare providers are credentialed and are able to do what it is they say they're going to do, right? And that's all part of assurance. Now, at the very inside of the circle, you see research. Research is at the heart of all of this, right? And so I think you guys remember, I hope your eyes don't glass over when you hear that word, or that you automatically assume it's boring, because research is not boring. Research is how we know, hey, if we try this, it works. Hey, if we do this, we can do it better. If we change this or offer this resource, we can get the kind of outcome we're looking for. Research can actually be really exciting if you're interested in the topic you're researching, that you're doing a more in-depth exploration, right? So we want to make sure that all of this is working. And so we're using research tools. We're using quantitative data analysis, right? Quantitative being that number, right? Whether it's medical numbers that quantify your health, your blood pressure, your weight, your BMI, your T cell count, your CD4 count, right? Just really dependent on what it is you're trying to measure. But we're also using qualitative. Hey, tell me about your health. That's part of giving a health report, right? But that's a story that you're telling. That's a narrative you're telling, right? About your family history, about what are the symptoms that you're experiencing right at this time. You're using research, you're using data to make sense of how to describe the problem, how to recommend interventions, how to actually implement those interventions, and then how do you use these research tools to evaluate whether or not your interventions are working. So really, Perrier, that evidence-based approach lesson that we discussed in the second class, it really goes hand in hand with the role of the government. Oh, here you go. Just to give you a little bit more to look at right now. That's how it really does go hand in hand with what is the government's role in helping to carry out public health. All right, so there are also different components of the public health system. So we've got federal agencies, and so those agencies you've heard of, right? The CDC, Centers for Disease Control and Prevention, AHRQ, even Indian Health Services, and the NIH, which is more of the biomedical branch. Those fall under federal agencies of public health. You also have tribal health, which kind of operate separately from the federal agencies, even though IHS is somewhat over tribal health. You've got other government agencies other than public health that create social policies which impact public health. You've got clinical care, so the hospitals and the clinics and the federally qualified health centers and your private practice physicians fall in that triangle. And then you have other groups that might not directly carry out healthcare, but do impact healthcare. Media, how do they let you know to be prepared for the next big flu? How do you get the information that tells you that this is a health issue you need to pay attention to? Largely from the media. Community-based organizations, whether it's a neighborhood group or a church group or a smaller nonprofit or a county level health group that's not necessarily organized by government. And then next up, you're looking at what are some private nonprofit associations, the Red Cross, Komen Foundation, and ways they impact health, educational institutions, which after watching or after kind of engaging in the health disparities lecture, you now see the importance of education, how that impacts health, but also there's school health, right? So how do we ensure that our children are healthy during their quote unquote job of going to school? And then there's also private industry. So these are all just different components of the public health system. We're going to focus a little bit more on those upper two tiers and kind of at the end discuss how these all work together to make up the public health system. So if you're thinking of kind of public health and federal agencies under this really large umbrella, think of the umbrella organization being the U.S. Department of Health and Human Services. The NIH and CDC and the different other organizations that are federal agencies fall under this larger umbrella of the U.S. Department of Health and Human Services. So when you're thinking of, and this might be important, wink, 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 wink. I don't know how to say wink anymore. But, just by saying wink, you should pay attention to this. So if you're looking at one person who's seen as the most important person in our public health federal agency, it's the Secretary for the U.S. Department of Health and Human Services. Think of that person as pretty much like the president of public health in the United States, right? So this person is selected by the presidential administration, right? So under Obama, we had first Kathleen Sebelius, and then later we had Katie Burwell. And now under the Trump administration, whenever a new administration takes office, they choose their new people. Sometimes they can keep the old folks on, but more often they change the people that are in power in different positions. This is a cabinet level position. So one of the president's top advisors on how to enact, in this case, health and public health and health law. And the job of that individual is to say, these are the president's priorities, and I'm going to help this individual carry out health in the way that I believe he or she wants, right? Like I know what this person wants. They're going to communicate directly with me, and we're going to set an agenda that helps meet the goals of that president. So we had Tom Price, who was the first Secretary of the Department of Health and Human Services. He was kicked out of office, and now we have someone named Alex Azar, who was sworn in back in January as the 24th Secretary for Health and Human Services. So this is the person who's seen as kind of like the president of public health, or president of healthcare and healthcare administration. So again, not the director of the CDC, not the actual president of the United States, not the Surgeon General. The Secretary of the Department of Health and Human Services is that kind of head honcho of public health leadership in the United States. All right, so if you see a discrepancy between the slides that I'm recording now and the slides that I had online, I just took out some of the information. I had like pictures of, I'm sorry, her name was Sylvia, not Karen. Sylvia Burwell and Kathleen Sebelius and Tom Price, and I decided to take it out because I just did. But now you know their history. I'm going to go through now and describe what are some of those other major public health related federal agencies and what do they do, right? These are, by no means are they all of them. This is not an exhaustive list of the agencies that fall under the U.S. Department of Health and Human Services. They're just some of the more well-known ones as directly related to public health. So we have the Administration for Children and Families. They're trying to promote well-being and health and education of children and families, right? Some of this might seem self-explanatory, by the way. There are also some really great charts in your book. It will be important, another wink, 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 to know, some of these major public health-related federal agencies, specifically like the CDC and the NIH and AHRQ. You don't have to memorize these definitions, but it's good to have an understanding of who does what and, be able to just recognize. That should give you an idea of what kind of question that would be. Recognize what they do and who they service. So the Administration for Community Living really focuses on community support for older Americans and people living with disabilities. Next up, we have AHRQ, Agency for Healthcare Research and Quality. They're looking at research designed to improve quality of healthcare, reduce its cost, increase patient safety, reduce medical errors. We have the Agency for Toxic Substances and Disease Registry, which helps prevent toxic exposures and adverse health outcomes that are linked back to toxic substances. We've got the CDC, which again, think of them as really the main agency that focuses on prevention and control of disease. They're really kind of that hallmark public health federal agency under the U.S. Department of Health and Human Services. There's the Centers for Medicaid and Medicare. Those are the public health insurances and trying to make sure that people who qualify via age, by income, and by disability have access to high quality care. We've got the FDA, which does more than just monitors food outbreaks or foodborne illnesses. They're also in charge of some pharmaceuticals as well as ensuring the safety of medical devices. We've got HRSA, They're really the health agency that focuses on reducing health disparities. So a lot of funding that comes for studying and understanding how to reduce health disparities really does come from HRSA. So they improve access to care for people who are uninsured, geographically isolated, living in rural areas, deemed medically vulnerable, whether it's by age or disability, immunofunctioning. They're again really focus on reducing disparate outcomes among populations. There's the Indian Health Services. They're responsible for public health for American Indians and Alaskan Natives. That's all part of tribal health. So you even have your own hospital systems who administer care through IHS. In the state of Arizona, the largest IHS hospital is actually in Phoenix. It's over kind of like around, I believe it's on Thomas, or I think it's on off of Thomas Road. It's either Thomas or Osborne, and I want to say like 12th or 13th Street in that area. So kind of close to downtown Phoenix. But a lot of tribal health takes place on tribal territories. But the larger hospital, in the case that your tribal territory doesn't have the capacity and the resources to treat patients, people are driven in from different parts of the state to receive medical attention from IHS. So again, that's to provide care for American Indian populations, Alaska Native populations, and families. There's the NIH, which we tend to think of more often as the larger biomedical and research branch, but really interested in discovering new treatments and understanding personalized medicine. How do you understand someone's personal genetic code and create personalized approaches to treating individuals? But they do some public health research funding. So take, for instance, some of your professors in the College of Health Solutions, myself included, when we go to conduct our research to say, hey, we think there's a better way to prevent and control disease, we'll often look at either the CDC or the NIH and say, hey, can we apply for funding from your federal agency? We'll show you why our idea is the best and it's going to have a good impact and it's creative, but it's not so creative that it just seems like a wacky idea, but that we've got, evidence and support from literature to say why we expect the kind of outcomes we'd have. Again, with the overall outcome of improving health outcomes and patient care. So again, some public health research is carried out through NIH, some through CDC, some even through HRSA. Just think of the NIH as the more biomedical branch. SAMHSA is Substance Abuse and Mental Health Service Administration. So, mental health conditions, treatment for mental health conditions, psychiatric disorders, mental disorders are housed under this, as well as substance abuse, which often, by the way, coincide. You'll find that when we talk about addiction, we'll talk about the role of this neurotransmitter called dopamine and dopamine receptors, and how a lot of people with addictive tendencies tend to really produce this feel-good chemical and this feel-good neurotransmitter called dopamine. And it drives people to continue behaviors that sometimes are not really healthy for them, right? So over drinking, over smoking, and like it drives you to want to continue doing activities because your brain, the pleasure center of your brain is like, I like this. It lights up. And that different stimulants for the production of dopamine release different levels of dopamine at that time. So like petting a dog actually releases dopamine. Eating food. When people are, falling in lust or love, their brains are releasing dopamine. When they smoke a cigarette, when they have alcohol and they're becoming tipsy, when they do hard drugs, your brain releases a certain amount of dopamine that says, I like this. But people who tend to have addictive tendencies continue to do this even when other parts of their lives are very negatively affected. So that's why addictions are also kind of housed under under SAMHSA for the under mental health, because there's this huge mental health component that feeds into addiction. All right. So the U.S. Department of Health and Human Services is actually split up into different regions. There are different leads that report back to the Secretary of the U.S. Department of Health and Human Services. So we're actually in Region 9. And again, each of these has a leader, their own committee, their own place where they're centered. The head for our region is in San Francisco. And again, they communicate back to, they take information from that region, combine it, make sense of it, and report that back to DC, where that's the main bridge. Actually, it's Bethesda, Maryland, but right outside of Washington, DC, is where U.S. Department of Health and Human Services is housed. So I have this map to show that states differ in the way that they carry out healthcare. So I want to take a step back and let you know that the level of government which actually has the most control for how healthcare is enacted is actually the state. This is important. Wink, wink, wink. Wink, 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 wink. So you can think of, the United States and territories as being just a kind of a bunch of little countries in the way that they carry out healthcare. They've got their own state health departments, they've got their own local health departments, but they're allowed to vote and decide how to interpret larger healthcare law. Here's why states have the most power. The U.S. Constitution, the Bill of Rights, everything that we have, nothing in that founding document states how healthcare and how public health should be carried out, right? This document that sets our country forth and says we're, our own entity, we're, autonomous from England, we got our own thing going on, doesn't say this is how public health should be carried out. It just wasn't the top of their priority at the time that they created this document. So over time, as each state has emerged, they've had their own local government, or their own state government, and states and state health issues can look different based on where you live, right? So I'm from Mississippi originally. That's where I am right now, recording this. You guys are over in Arizona. Health concerns that are in Mississippi look totally different than health concerns that are over in Arizona. Look totally different than what's going on in Washington State or Maine or Michigan or Minnesota or Hawaii, right? We have different health concerns. And so we have the power as a state to take the law from the federal government and to interpret it to the best way for our state, right? So this map shows you different colors. You'll see green, where it shows you that there's more government control at the local level. There's yellow, in which that most of the power for the state is really at the capital, state level, state department, and that branches of local departments feed information to the state health department, but the state health department really is the one in power, right? And then there's mixed, there's shared, where some of the power lies mostly at the state and state capital, and others are dictated more at that local level. So the green, when you see the green states here, you see that communities and counties more often are seen as their own independent little areas that can dictate the way that health is run within their communities. Yellow is where, no, the state dictates, the state is the main central power, and then think of all of the local health departments as little mini satellites, and the state decides how to carry out health, and the satellites just kind of follow what the lead says. And then everything in blue is mixed, everything in red is really a shared 50-50. You see much more, though, that states have that local health departments and local entities, local government, have more say over how to carry out health as compared to the state as a whole. And that makes sense for a lot of states. Like, think about the state of Texas. This thing is like the size of a country. Look, this guy. It's huge, right? you've got El Paso in there, and you've got Austin in there, and you've got these little tiny rural towns, and you've got Houston. And these cities all look very different, and they're so far apart. And they've got different populations and different demographics and even different politics, right? Where you'd find probably a more liberal government that you'd find in Austin and larger cities. Then you find super conservative little pockets through the more rural areas. And so what they prioritize and how they allocate resources differs. So it makes sense that local health departments have more of a say as to how to carry out health in their community than Austin, Texas, saying, this is what we're doing for Austin, so little health departments, you do what we say. They just look so different that it just doesn't make sense to carry out health that way. All right, so greetings from Arizona. Let's see what's going on in Arizona. All right, so I have these links up here, and I want you guys to go in, and I want you to explore them. I'm not going to explore them right now. I'm afraid of losing you. I'm afraid of stopping the recording if I accidentally navigate off of the software I'm using to record this. But go through these, and here's why. That final project that you have at the end of the year, it's focused on identifying health disparity, doing a literature review to dive deep and understand what is that health disparity, and to interview a representative from a nonprofit or a for-profit or a state government agency to ask how they try to reduce the health disparity. And then based on what you learned in literature about reducing the disparity and what you learned from that community contact, make recommendations. If that sounds scary right now, don't let it freak you out. Don't let it scare you. But I do want you to start understanding what are some health disparities that are Arizona health disparities. What are health conditions? And part of it is making sure that children are insured, right? That children have health insurance and are receiving care. There are much higher rates of skin cancer. Looking at which populations are more likely to develop type 2 diabetes. You'll find Native American populations have really high rates of hypertension and type 2 diabetes. So if you go through specifically this Arizona Disparities Dashboard, it's really cool because it kind of looks like what you'd see on your gas gauge for your car, right? Like an empty all the way to full, but instead it's kind of like green light, yellow light, red light. Green light means, hey, we're doing good. We're, compared to the rest of the country, we're doing great in this area. Yellow means we're doing all right, but we really could improve. And red means, whoa, okay, we need to slow down and we need to figure out what's going on here, and we need to think about solutions to these disparities because they are identified as true disparities at the state level. And there are these disparities as well, often for like Maricopa County as well. And that's that bottom link, is understanding community health improvement in the tracker. Are we doing better? Are we on target for our goals? Are we reducing disparities? Yes, no, why not? That information can be found on these links. So when you have time, go back through the slides that are posted, check out these sites. Nothing else, just get a pulse of what's going on in Arizona so you can be a bit more informed of what's going on in your state. I also want to highlight that we have quite a few tribes in the state, and these tribes are also housed under Indian Health Services and have their own tribal public health. Here's something I didn't know. Tribes do not have to, this is just kind of a random fun fact. I'd called, I think, the Navajo Nation last week to contact them for a rural health project and realized they had a different time zone. That tribal communities can choose if they want to abide by the rest of the country's time zones or if they want to do the Arizona time zone with the rest of the state. So although it was the same exact state, I called this, actually I was calling a pharmacist in Navajo Nation and found out they're on a completely different time zone. So anyway, they've got different laws and abide by different sets of health laws and regulations for tribal health. So it's a separate entity, but housed under Indian Health Services. Okay, and there are also U.S. territories and freely associated states. So giving you some examples of health territories, probably Puerto Rico is the first thing that came to mind. That yes, people from Puerto Rico are treated as citizens because they are, right. But it's a U.S. territory, and you'll see that the way that health is carried out there even looks different from the mainland, from the main United States you think of when you look at a map of the country, right? We also have Guam, American Samoa, North Mariana Islands. So this map is just basically to show you where these are located, as well as what is Micronesia? Where not so much where's Micronesia, but what are the Marshall Islands? Where are the freely associated states that are also insular areas? And you'd probably assume that healthcare looks very different here as well as the rest of the United States, the actual states themselves. More often, it's harder to get resources out to these areas. They have totally different methods of governing their insular territories, as well as their insular areas, these territories. You'll find different histories. You'll find different demographics of people living out there, different history, different approaches to life, different ideas of what causes disease. But the allocation of resources and the way that they carry out healthcare is also different, just because the United States is slower to get resources out to them. So I don't know how many of you guys followed what was going on in Puerto Rico after Hurricane Maria last year, but it was difficult ensuring clean water and making sure we have food and making sure they had the resources they needed to get back on their feet after the storm that knocked out their power on a huge proportion of the island. Interestingly enough, I think it was last week or the week before, they said it was something closer to like 14,000 deaths, I believe, that came from Hurricane Maria over, since this time last year, that had been vastly underestimated. But getting resources, ensuring the same kind of rules and regulations are in place is much more difficult in these areas. And although they're a part of the United States, they're not always necessarily treated as such. So I want to kind of tie it back in and kind of go back to that idea of all of the different entities that make up public health. So you've got, we discussed today a little bit about Federal Department of Health and Human Services, state and local health departments, and tribal health. By the way, your book also does a really great job differentiating, what is done at each of these levels, like immunizations, keeping death records, credentialing your hospitals, ensuring, accreditations of medical schools, of nursing schools, making sure restaurants are safe, making sure that people have access to healthcare and they've got health insurance, right? These all fall on the shoulders of different parts of the government. And your book does a really good job of helping to kind of unmuddy those roles. But we also have different partnerships that contribute to how we carry out public health. We've got churches, right? They're really interesting interventions where people talk to pastors or leaders of a church, or you have to get buy-in from this person in the church in order to get this health information or give this health resource to folks. Schools are involved in public health. How do we make sure our students are prepared, that they have access to food, that they've got access to healthcare if they're sick? How do we get information out to parents in a timely manner? Oh, your child needs to get this immunization, right? Or make sure they're going in to receive dental care once every 6 months or at least once a year, right? Businesses are involved, healthcare providers, right? Whether it's your physician's assistant, your physician, your physical therapist, your dentist, your healthcare workforce, right? All have a role in carrying out public health. Environmental health folks, right? Mental health practitioners, social workers, community service organizations, transportation. If you guys remember the Ebola outbreak, you remember that transportation was critical to make sure that, engaging transportation agencies, engaging TSA specifically, was something critical to try to stop some of the flights that were coming in from Ebola-affected areas into the United States to try to quarantine Ebola and to keep it out of the United States. Didn't work too well. We had an outbreak in Houston and a couple other locations. But we engaged transportation, we engaged the media, we engaged churches, we engaged different entities to say, help us in preventing or controlling the spread of Ebola. You've got philanthropic groups that go out there and raise money for a good cause, whether it's Komen for breast cancer, or the Red Cross to make sure that we've got resources when there's been a time of natural disaster, blood supply at the time of a disaster. We've got law enforcement that helps to kind of help mitigate any other issues or problems that may occur during a man-made disaster and also natural disaster. And the way that these are all connected is to have a more integrated system, and that's actually our goal. When we talk about emergency preparedness and response, especially when we talk about the response to 9/11, you will see how critical it is that first responders talk in the same language, communicate effectively with each other, and how critical it is to take this information and give it to people who can make sure that people in their communities and their churches and their schools and their workplaces get this, to stay put or to stay out of the way of danger, or to go to these different locations to enhance their likelihood of survival as well as prevention of disease during a time of emergency. So in a perfect world, all of these are very well integrated, communicate with each other regularly. And the goal of public health is to take people from these different disciplines, to take people from these different organizations, bring them to the table, and have this collaboration that understands what a problem is, understands and communicate what's the etiology, as well as how do you stop the cause of the problem, how do you make a recommendation for a policy change or intervention, and how do you implement it, and then how do you make sure that that intervention did or did not work, right? So again, this goes hand in hand with evidence-based practice and with that Perrier acronym that you learned that came from chapter 2 of your book. So that's all I got.